Life is filled with moments you don't want to miss. But many people who wear traditional hearing aids still don't hear well, especially in noisy situations. Introducing EarLens, a revolutionary new hearing technology. EarLens uses a tiny custom-fit lens to gently vibrate the eardrum, giving you 2.5 times the bandwidth of traditional hearing aids for dramatically better speech understanding. Why settle for traditional hearing aids when you can wear EarLens?
Today, more than ever, patients want convenience, safety, and simplicity. With the Mini Cat, we are able to deliver high-quality scans of the sinuses and ears in the office today. Sit comfortably in an upright position as the overhead arm makes a single rotation around the head. Mini Cat scans have significantly less radiation than the traditional full-body scanners, and a typical scan only takes about 20 seconds. Find out how the Mini Cat can be a game changer for your health.
When everybody else goes to sleep, WatchPat starts to work. This breakthrough home sleep apnea test is clinically validated compared with PSG, and its PAT technology is an adequate measure in the AASM guidelines. With only 3 points of contact, WatchPat makes home sleep apnea testing as simple as clicking a button. WatchPat continuously monitors various aspects of sleep and collects data from 7 different channels. This unparalleled simplicity and ease of use delivers a 98% study success rate without compromising diagnostic capability. It detects movement, snoring level, body position, chest movement, heart rate, oxygen saturation, and PAT signal. During an apnea event, the airway collapses and blocks the supply of fresh air. Eventually, the brain generates an arousal through activation of the autonomic sympathetic nervous system. This sympathetic activation leads to vascular constriction and an increase in pulse rate, which is reflected in the peripheral arterial tone, PAT, and detected by the WatchPat finger sensor. This highly comprehensive diagnosis provides all major indices, including AHI, RDI, and ODI calculated based upon the patient's true sleep time and sleep staging, as well as reports central apnea. True sleep time reduces the risk of misdiagnosis by 20% in comparison with ASATs using total recording time. WatchPat's clinically validated sleep architecture provides information on sleep stages, including sleep efficiency, sleep latency, and REM latency. Once the device is returned to the clinic, within 1 minute, the raw data is downloaded and analyzed by a proprietary algorithm, and a full, comprehensive sleep report is issued, including all the needed indices for obstructive and central sleep apnea, sleep architecture, body position, snoring, and more. The WatchPat family of products and services offer a streamlined, customizable, and cost-effective way to manage the increasing volume of patients seeking diagnosis and treatment for their sleep apnea. Incorporating unprecedented simplicity, accuracy, and reliability, it's no wonder thousands of clinicians have chosen WatchPat as their first choice for home sleep apnea testing. Itamar Medical.
Hi, my name's Charlie. 5 years ago, I was diagnosed with obstructive sleep apnea. My doctor says obstructive sleep apnea is the most common sleep-related breathing disorder. It causes me to repeatedly stop and start breathing while I sleep. The muscles in my throat relax and block my airway, causing my body to continually wake itself. I know that leaving obstructive sleep apnea untreated can have long-term effects on my heart and brain. I needed a solution. I tried to solve my problem with CPAP, but it wasn't for me. So my doctor talked to me about Inspire therapy.
Helping you find a therapy that works for you and your lifestyle is important. For those who have tried and struggle with CPAP, Inspire therapy is a great option I like to recommend. Inspire therapy is an implant that works comfortably inside your body.
I don't think I want surgery.
I get it, but this is not like other sleep surgeries that you might be familiar with. It's a short, outpatient, and safe procedure with a quick recovery. Let's walk you through it, okay?
Sure.
Inspire syncs with your breathing to gently move your tongue forward when you take a breath, keeping your airway open so you can breathe regularly and sleep soundly. During an approximately 90-minute outpatient procedure, Inspire is implanted right under your skin near your collarbone. Second incision beneath your jawline connects the implant to the nerve in your neck that controls your tongue.
Sounds interesting. And expensive.
Inspire is covered by most commercial insurers, Medicare and the VA. What do you think?
Let's go for it. Once I completed and healed from my procedure, I worked with my physician to customize my Inspire settings so the therapy works best for me. While the implant works in my body, the remote controls how I turn it on and off and connects to the Inspire app on my phone. I can't believe how much better I'm sleeping and how energetic I am during the day. I finally feel like myself again.
The Express ENT dilation system provides lasting relief for many patients with sinusitis symptoms. Chronic sinusitis is inflammation of the sinus cavities. Those who suffer from chronic sinusitis may have nasal congestion, facial pressure, and a decreased sense of smell interfering with their quality of life. 1 out of 8 adults in the United States suffer from chronic sinusitis. If you've experienced these symptoms or have recurrent acute rhinosinusitis, speak with your physician about whether balloon sinus dilation, a minimally invasive sinus procedure, could be the relief you need. The Express system for balloon sinus dilation procedures enables physicians to dilate sinus openings and pathways, which can provide relief from discomfort or persisting symptoms. The device is indicated to treat 6 sinuses, 3 on each side of the body: the frontal sinuses, the maxillary sinuses, the sphenoid sinuses. To treat the sinuses, a small balloon is inserted into the opening of the sinus. The balloon is then briefly inflated to dilate the sinus pathway, then deflated and removed to restore drainage of mucus and help resolve sinus symptoms. For more information, speak with your physician to address your questions around chronic sinusitis and the Express ENT balloon dilation procedures.
Millions of people suffer from chronic rhinitis, a frustrating and often undiagnosed condition characterized by symptoms such as a frequent runny nose, nasal congestion, postnasal drip, and others. Chronic rhinitis is caused by overactive signals of specific nerves inside your nose, which cause overproduction of mucus, inflammation, and swelling. For some people, the condition is made worse by seasonal allergies, while others suffer all year long. If you are tired of dealing with these symptoms, Rhinair may be right for you. Rynair is a non-invasive and long-lasting treatment for chronic rhinitis and can be done from the convenience of an ENT physician's office. Rynair uses incisionless, low-temperature radiofrequency energy to calm the overactive nerves that cause chronic rhinitis. After applying local anesthesia to temporarily numb the inside of your nose, the physician will insert the small wand into your nostril to deliver the low-temperature treatment. The physician will use the wand to precisely target those overactive nerves as well as shrink inflamed soft tissue to help relieve congestion. Patients generally only feel minimal discomfort and can typically get right back to their normal daily activities. In a clinical study, patients treated with Rynair reported significant and long-lasting reductions in their chronic rhinitis symptoms from allergic and non-allergic causes. To learn more, visit Rynair.com or talk to your doctor. Over 20 million people in the U.S. struggle with nasal airway obstruction, or NAO, and deal with side effects such as nasal congestion or blockage and difficulty breathing through the nose during sleep and exercise. NAO is caused by an anatomical narrowing or blockage in the nasal airway. If your nasal airway is too narrow or obstructed, it can make drawing air through the nose very difficult. One way to tell if you may have NAO is to try the coddle maneuver by placing 2 fingers on each side of your nose and gently pressing while pulling outwards. If this helps you breathe better, you may be a candidate for Vivair. Vivair is an innovative treatment that provides long-lasting relief from NAO by remodeling your nasal airway without invasive surgery. Using incisionless, low-temperature radiofrequency energy, Vivair significantly increases airflow and improves nasal breathing. In contrast to more invasive alternative procedures often performed in the operating room, the Vivair treatment can be done from the convenience of an ENT physician's office. After applying local anesthesia to temporarily numb the inside of your nose, the physician will insert the small wand into your nostril to deliver the low-temperature treatment. The physician will use the wand to target and remodel specific areas of swelling and blockage. Patients generally only feel minimal discomfort and can typically get right back to their normal daily activities. In a clinical study, patients treated with Vivair reported significant and long-lasting improvement in nasal breathing, sleep quality, ability to breathe through their nose during exercise and exertion, and other quality-of-life measures. To learn more, visit Vivair.com or talk to your doctor.